Tell us about your experience. Who introduced you to this? What caused you to believe in it? And tell us some really interesting
Uh,
patch protocol about vision care.
Okay, yes. I'm on video, right?
Yep, you're on. I see you.
Okay. All right. I have done light therapy for over 20 years. It's part of my practice. I'm an optometrist. We do vision therapy and I do traumatic brain injury therapy. We have people with concussions that benefit from this. Light will enter 86% of the brain. So the vision fibers in your optic nerve reach everywhere. So what you can do with light is send comforting, healing light in, and it reaches everywhere in the brain. It's really cool. I did concussion therapy on the person that sponsored me. Her son was playing soccer, had a concussion, and through this light therapy, she felt it was very, very successful, bringing her son back to normal comfort. So that was in 2014. So she comes last November, and tells me about a new light therapy that they had. So she explained it, and I said, well, this makes sense. It uses the extracellular matrix. The light then reflects back in, and it would be a very logical sequence that this should help. So I started on the Monday after Thanksgiving myself, and the reason I was interested, I have a late onset muscular dystrophy that is involved in my legs. So I have a wasting of the muscles and a loss of sensitivity. So I would walk downstairs, I wouldn't slowly step. I would basically drop every step. I would drop down to the next step. Didn't have the ability to gradually lower myself down. And then going upstairs, I was starting to have to pull myself up the stairs. So on day 5, on Friday, walking down, my personal office is on the second floor of my office building. So I would walk up and down a lot. And I was able to tell I am quieter. I am not making the thunking sounds. And so I knew, okay, in 5 days, uh, this is good. This is not a problem to start recommending. So I got that benefit. So right now I was not able to walk up and down stairs uh, without holding. So now I can carry things upstairs, carry things downstairs. I feel like this has been a big deal. And so I've really enjoyed that. The From an optometry standpoint, I have a son in Chicago actually that we would go up to visit about every 5 or 6 weeks. And coming down on 55, there's an area in which you are elevated and you can see way, 10 miles around. And it's like, my night vision is significantly better. This is cool. It was noticeable to me. I'm saying I have the night vision that I had 25 years ago. And there's actually a device called an M-Pod, which measures your macular pigment density. And I am 72, and my test on that was 63. Well, average is in the 30s. So I have the ability to handle too much light. When we walk out of church, there's a big, nice, bright white concrete, and I don't have the glare from the concrete like I did before. So the M-Pod is a way for the eye to absorb the excess light. So my night vision is better. My glare reduction is better. So it's a big deal. I've really enjoyed that. Um, as far as patients, you talk about quick um, one patch changes. I have a patient who um, the wife agreed, okay, we're going to patch her husband with Parkinson's. One patch, and that night he was walking without dragging his feet. He was a little bit faster on the walking, and it's like, we need these. Okay, a gal in her early 50s um, had hot flashes. I said, let's try this. After 2 days, she's anxiously on the phone. I can't run out of these. Okay, so that was cool. And then one of my brand partners, blood sugar went from 128 to 103 at the end of the week. So those kinds of things are really, really good. From a eye doctor standpoint, to me, the pigment increasing by the use of just X39 says that macular degeneration will reduce and or won't advance. You know, there's people now getting injections to prevent a eye from going from dry macular degeneration to wet, and you inject in the eye, which is crazy to do, and this will reduce the amount of that that's needed. There's a couple of patients. I haven't had one that has finished it yet, but you have droopy eyelids. Okay, so if you put the Y age on your face, I'm telling people in 6 months you will not need an eye lift. So I've read that, and so it's a fun thing to try and find out. I'm very believing of that. I look at myself in the mirror, and my lids don't droop like they did when I started. So you know, you'd wonder, okay, how much of it is the patch? And I have not done that. That's just the X39 and an occasional Eon or carnosine and so forth. But I'm happy to answer questions. Joe, what did, have I hit the things, all those that we talked about?
No, you hit on everything. I think that's wonderful. Why did I hear you say that you call this the missing link for eye care?
Okay.
These are the 9-inch Guggenheim Professional Tailor Shears.
Back to the earlier comment about the ability of the body to send extracellular information throughout. And so it is, light is universal throughout our body. We are, as you know, making light. So we give off this. So the ability to modify that light we are giving out, modify it so as to activate different peptides that your body makes, is astounding. So it's that, then that plus the fact that our vision is our most important aspect. It's really, you know, we see people lose their vision, and on a day-to-day basis, I'm trying to protect a person's ability to keep their vision. And I have a lot of 80 to 100-year-old patients, and they are often very worried about what the future is going to hold. So as far as a missing link, it's the using of light for the retina, and the ability to maintain the retina is magnificent.
Wonderful. Yeah, I talked to my cousin Doreen. She's a ophthalmologist, and she said you cannot inject stem cells into the eye lest you risk blindness. In fact, people are going over to China having that procedure done, and unfortunately, it's resulting in blindness. So this is probably the next best alternative to injecting stem cells into the eyes.
Yep. Also, the macula is the center of your vision is the fovea, and then the macula is 10 degrees around that. And it's the highest metabolic rate in the body. There's more blood going around the eye and through the eye. Over 20% of your heart output goes through that. So it's the highest energy consumption, and that's a detox needed. So macular degeneration is the inability to allow the metabolic processes to take place without removing the metabolic waste. So it's interesting that the X39 on its own will increase melatonin. Melatonin is a part of the retina is using melatonin, and it is the ability to handle glare and all of that. So melatonin being made says that the X39 has the right makeup to really help the eyes.
Wonderful. There was a patch protocol. We had another young lady on the call who was legally blind in one eye, and you recommended Eon on her forehead, glutathione on her temple, carnosine on her other
Yes,
temple.
yes.
Can you talk about that protocol a bit?
Okay. Let's talk about a patient of my my main assistant, my gal Friday at the office. Her mom just came up with essentially a stroke in the eye, very similar to this other person. So carnosine is going to support the nerve, all the nerves around the eye. Eon is going to be inflammation, which is their inflammation is just locked up the nerve there. And then glutathione is a detox. So you got all three of those mechanisms taking place that are needed. And the ability to put them here and here is going to focus it. Yes, you can put them on your back, you can put them other places, but those are then close to the action of where it's needed. And that to me is powerful, that combination.
Absolutely. Very good. Do you have time to stick around after we're done here and open it up for Q&A?
Absolutely.
Okay, wonderful. Thank you, Dr. Roger Fitch. That's a huge blessing to many people on this call, I know. So there you are. There's one of your photos, and we'll come back if anybody has questions for Dr. Fitch.